Oh, we're back. Dr. Staci and I are on to part two. Staci, you are in the desert,
I
enjoying yourself.
am.
Good. Nice
Yes,
dry
we're at
air.
a 50th birthday party and college reunion weekend.
Oh, good. I hope you are enjoying yourself. You deserve it. So today we're going to talk about part two. This is the hydroxyapatite series. Last week we spoke about what is it, and that was a pretty simple topic. Today is probably our beefiest chapter on hydroxyapatite. How does it work? Next week will be, or later, actually within the same week, maybe a few days after this one, it will be more about safety. That's a pretty difficult topic to handle, but this is probably the meat of the discussion, and it's also very, very important. And there are a lot of dentists that really will be listening because they don't understand how it does work. Although we were just talking offline earlier. You were talking to some IFM dentists, as you are one of the few functional medicine trained dentists. There's a lot of interest now in the mechanism of how this works, and that is because they've seen it work. They've been using products that we've recommended for quite a while now, probably 4 or 5 years, and they're seeing efficacy. And in fact, their minds are being blown. They really are. And this was during one of your seminars, and it was not on the seminar, but I guess before or after you were speaking to them, they pointed out that this stuff works. Of course, you knew that, right?
I mean, I've been seeing it clinically for years, yeah,
Right.
and just continuing to improve as I think the brands are improving too.
Right.
But it's nice to see some of my functional medicine and dental colleagues starting to see clinical results as well and really feeling confident that they can 100% move away from fluoride
Right.
and have even better efficacy and outcomes for their patients, which again, yes, I've been seeing that for many years.
And without being exposed to fluoride. Isn't that wonderful that we have this replacement? So let's talk about how it works. That's important. And we're not gonna go too deep in on this, although that's easy for us to do. We want to keep this to 30 minutes. And so let's start. So how does it exactly work? We're going to talk about critical pH very quickly. That's important. That's kind of the basis for how anything remineralizes, any tooth remineralizes in the mouth. What is the ideal toothpaste pH? We're going to talk about ionic integrity, remin and demin, remineralization, demineralization. We've talked a little bit about that already, but we want to talk about how it works, how fluoride fits into the picture compared to hydroxyapatite. We're going to compare the two. And then we're going to dive a little deeper into the actual mechanism. What is a therapeutic dose? And then we're going to talk about different brands and concentration claims that you need 10%. We're going to debunk that, and we're going to reference some studies. So, okay, so how does it exactly work? I think we should start off again with just a short discussion on the difference between nano and micro. Nano is under 100 nanometers. It's a smaller product. It is made, they take the microparticles, which are over 100 nanometers, and they process them down to a smaller size. That is the only difference, although there are different sizes and different particle types, and we've talked about which one we like. We're going to talk more about that in the next chapter about safety. So how does hydroxyapatite actually remineralize teeth? And we know that it's what's in teeth, it's in saliva, it's a mineral, it's calcium. How does it actually bond onto a tooth surface? Does it just happen all the time? Does it happen certain times of the day? It typically happens, here's the answer to that in one sentence. It happens at a critical pH level. In other words, it occurs only when the pH in the mouth drops to a lower acidic level. So when I say lower pH, we're talking about more acidic. And that critical pH has been long known. We've known that with fluoride remineralization, that critical pH is actually a little bit lower. But with hydroxyapatite, it's higher. But when does a tooth demineralize? And that usually happens at around, I mean, for dentin, which is the root structure of the tooth, it happens at around 6.4. Again, neutral being 7. So the resting state of the pH of saliva is around 7. It can drop to 6.8, 6.9. But if it drops below 6.4, there in dentin, in the root structure of the tooth, there is dissolution. In other words, it's an acidic enough environment where calcium is being dissolved out of this hard structure called the tooth. And it's a little bit lower, more acidic for enamel. What is it, Staci? It's 5.6?
5.5.
5.5, right.
Yeah, so between 4.5 and 5.5 is when, the biofilm will start producing acids from sugar or flour. I always like to say flour now consumption, just from an educational standpoint, which is why, hydroxyapatite's critical pH is 5.5 and fluorapatite is 4.5. So hydroxyapatite really, if you look at the mechanism of action of our bacteria, it really is at an optimal state before it starts dropping into a level where these bacteria might produce acid. And that's one of the controversies of the quote unquote anti-fluoride movement, is that fluoride, you really need to be in a more acidic state for it to be efficacious.
Right.
And so long term, if you're using products that are this lower pH, what is that doing to your oral microbiome, and then just to your enamel as well?
In fact, toothpaste that contain fluoride tend to be more acidic because they want they want to drop that critical pH, which is not a good idea. The good news is that dissolution may occur at a higher critical pH with hydroxyapatite. In other words, the calcium is coming out of the tooth at a pH of 5.5, but that means you can make a more neutral toothpaste. And then as soon as the critical pH recovers and it goes beyond that, remineralization starts occurring. That's for enamel. It would be higher with dentin. But the pH is really, and again, critical pH, but critical pH is a condition, is that movement past a neutral pH, and pH rarely goes into the alkaline. You could drink a lot of alkaline water and that's not really going to move the needle. But when you're eating flour, crackers, candy, sugar, processed foods, these bacteria in the oral microbiome, in the biofilm, are consuming this food, and that's where the acid comes from. It's a byproduct of the metabolism of that meal that they're having, the meal you're having, same meal that they're having at the same time, and you're producing a lot of acid. So unless you're eating raw carrots, there's always going to be an acid attack. So the question is how low do you go, and what are you remineralizing with? That's very, very important. Very interesting fact. Just want to add this. The critical pH for children is actually higher. So they actually, at a higher pH, in other words, closer to neutral, they start demineralizing. In other words, they're getting cavities sooner and at a higher pH. And that's probably why kids are getting cavities more than adults. Which,
we know the enamel of primary teeth, it's a totally different beast than the enamel of permanent teeth. And anyone who works on primary teeth will tell you that, just the way it feels if you're drilling it or lasering it. It's just less mineralized.
Right.
And so it does break down and degrade much faster. Partly why cavities are still the #1 chronic disease in children, because they are being exposed to so many sugars and flours. But I will tell you, the hydroxyapatite kids in my office, I mean, they come in and they look so healthy. And it's not just their teeth, but it's their saliva, it's their mucosa.
Right.
You can just tell clinically after seeing so many children, their oral microbiome is more balanced. And what's really wonderful about hydroxyapatite is that it does support the oral microbiome and it modulates the biofilm, something that fluoride does not do. Fluoride is antimicrobial. And so it is affecting commensal bacteria, and to what extent, that's the debate. But so many patients will switch to hydroxyapatite and just even self-report that they feel healthier, their teeth feel stronger, their gums feel healthier, and it has to do with this biofilm modulation that hydroxyapatite can influence as well.
Right. So in summary, critical pH, the lower the pH, in other words, more acidic, the higher the concentration of calcium and phosphate. is required to reach saturation with respect to hydroxyapatite. This is called the critical pH. It's kind of an equilibrium point, and it's important to have this discussion because it's the basis for what we're going to talk about next, which is the integrity of the saliva in terms of this ionic mix of minerals. We're going to get into that in a minute, but it's an important discussion because dentistry is long known about this, and we've talked about it, but we kind of skim over it real quickly, and we just take for granted that we're all going to be eating a crappy diet, we're all going to be demineralizing our teeth after every single meal, and that fluoride's going to come in and fix this. And that is, other than fluoride being a neurotoxin and affecting our brains, it really is not the discussion that should be discussed. It should be more about an understanding of how to buffer that or to minimize that critical age, drop into those zones less. In other words, don't snack all day long and prevent the equilibrium from fixing itself. In other words, if we're snacking all day long, the body can't catch up. It cannot remineralize itself. So that's the discussion that functional dentistry is having, but mainstream dentistry doesn't seem to really focus on. So, okay, ionic integrity. What is ionic integrity? It is a term that I think I've seen in print, but it's important that the components of saliva, in this case, for remineralization, which is a mix of minerals, and in fact, that's what saliva has been referred to. It's a super saturated solution of minerals, and it's standing by as a kind of a storage unit, like a gas tank, and it keeps the engine running. And when that critical pH drops, and all of a sudden that equilibrium is present where ions are leaving the tooth, we want a lot of ions. These are positively, they're charged ions. These are minerals that have a charge to them. They are present in saliva so that when the critical pH goes back beyond that equilibrium, closer to neutral, all of a sudden, all these minerals are being pulled in by the biofilm and fixing and repairing the tooth. That's what needs to be there. If those minerals are not present, or if the consistency of the saliva, again, this is that integrity, that ionic integrity, or the mineral, the minerality of, to use a wine term, the minerality of saliva is very, very important. So if you're dehydrated, or if you're not getting enough minerals or electrolytes in your diet, you won't have that backup system, that reservoir of products of minerals to help remineralize your teeth. So that's what we refer to as ionic integrity. There are lots of studies on it. We've posted them. I'd like to put them on our hydroxyapatite database, probably in a separate folder, because it is very closely tied into it. Again, saliva is a supersaturated solution of hydroxyapatite in its micro version, typically, which can break down to nanoparticles, to smaller particles. Again, when it dissolves, it is taken up by the tooth. Bacteria are actually processing this and laying it down and putting it into these defects, which occur pretty much after every single meal.
And what's great with the nano, again, going back to the size of the particle, is that the nanoparticles can actually get into the tubules, which are the smaller, almost think of like little pinpoint holes that travel through your tooth. They can actually get inside of them and then start to occlude and block them and resurface them. But we need to remember, we have hydroxyapatite already in our saliva. We have calcium and phosphorus in our saliva. What these toothpastes are doing are supercharging your saliva because, as Mark mentioned, so many of us are mineral deficient. So many of us are dehydrated. And that is just the modern world, unless we're eating carrots, as you said, which we're not, we are probably out of balance. And the way that we're eating snack foods and processed foods and sipping and snacking all day, we really want to supercharge our saliva, just like now we know many of us need to take trace minerals and magnesium systemically because we're mineral deficient. Our saliva is also mineral deficient. And so how can we supercharge that? It's with these products. And so it's pretty cool. And, you know, like the basic chemistry with ionic integrity, as Mark mentioned, is opposites attract, you know, so we want positively charged ions and negatively charged ions, and you know they interact and they balance each other, and we all need a little lift these days because of the modern diet, and so that is where nano and microhydroxyapatite come in.
Right. And this is a system that the body has had in place for a long time. The system is overcome when we're working hard or providing for a lot of demineralization, and that's the key. You don't want that to appear too often. Snacking all the time on sports bars and crackers essentially is what takes us down. It's really time spent under that, below that critical pH. So again, ionic integrity. You can have a well-functioning oral microbiome. You can have the optimal biofilm. Your pH and saliva is fine, but if you don't have the degree of concentration, that supersaturated solution of not just calcium, but phosphorus, boron, all sorts of other minerals, magnesium. These are the building blocks. This is the integrity. This is that ionic integrity. If it's not there, remineralization will not occur. You need it.
There's something that we teach at my office, and we can link some images in the show notes too, but it's the Stefan curve, or this, I don't know how to say it.
Stefan curve, yep.
Okay.
Yep.
We show this. It's a wonderful visual of what is ideal and optimal eating, drinking, and to maintain that remineralization, demineralization cycle that will happen anytime you put anything but water in your mouth, versus what actually happens to most of us on a daily basis, because we're sipping on our lattes and we're snacking on crackers and we're just overeating. We're putting things in our mouths too frequently, which is keeping us in a state of constant demineralization or acidity. And so, you know, you and I believe hydroxyapatite is an absolute wonder and magic, but unless we also correct some of these habits and eating frequencies, you know, you're probably still going to be out of balance. And then functional medicine providers will tell you how important it is to eat less frequently and more on a schedule for gut health too, because it's all in digestion, and we need to be giving our guts a break. They need to rest and digest. So it's the same with your mouth. You need to give it time to rest. You need to give it time for your saliva to work optimally and actually raise that pH again and remineralize your teeth. And this is where hydroxyapatite comes in, is again, it's supercharging your saliva. So, and it really clinically is incredible.
Yeah, our ancestors did just fine, and you know their Stefan curve looked way better than our Stefan curve does right now, and that's because they didn't have the luxury of being able to snack. And if they did snack, it was typically a piece of goat meat that was underneath their saddle that was being tenderized, or it was a fermented goat milk, or you know that kind of thing. So they didn't have to worry as much. Let's talk about fluoride. So hydroxyapatite and fluoride, they're both negatively charged. You can ingest fluoride. Fluoride is present in saliva if the child is taking fluoride supplements. It can also be present in your bloodstream if you're ingesting fluoride. These are not good.
Let's point out, it's not normally present in the human
It's not a
body.
nutrient. It's not an essential nutrient.
No one's fluoride deficient.
Right. Somehow there was a dentist in Colorado back in the 30s or 40s, and then the profession got behind it just by making a few.
It was observational.
Yeah.
It would not pass evidence-based medicine and
today.
Research right now.
Right.
No, it would not. No.
But we've stood behind this as a profession, which was a big mistake, and I think that's going to become clear in the next few months based on this lawsuit against the EPA. But anyway, fluoride does work. I mean, we're not going to deny that. It has that opposite charge, that when the tooth is demineralized, there is an ionic attraction, cationic, and that does happen, but it happens at a lower critical pH. So the problem is that when fluoride does become incorporated into the tooth structure, it doesn't penetrate as deeply as a nanoparticle will. It is not biomimetic. In other words, there's no tooth in the world before we introduced fluoride that has fluoride in it. Same thing with our bones. And when it does become incorporated into the tooth structure, it is brittle. Has a wavy surface structure to it. It's brittle. It's just not natural. And although it does, again, if you throw anything into saliva that has the opposite charge of what the tooth does during that demineralization phase, it's going to get attracted in there. We could take a radioactive ion and pull it into the tooth structure. In fact, that's been done. They do that in studies sometimes to see how things get past membranes and biofilms and all that. That's not desirable. Why wouldn't we want to take something that is already in the tooth structure, something that what we call biomimetic, something that's natural? That's what the body makes a tooth from. Is hydroxyapatite, calcium.
97% of our enamel is hydroxyapatite. 0% is naturally fluoroapatite, which is what happens when you incorporate fluoride into the saliva or to the tooth structure. So it creates a Franken structure, if you will. So it's called fluoroapatite, but this, again, it's not natural. And so while it may quote unquote work and make the teeth more acid resistant, the big question is at what cost, and what are these ions, these fluoride ions, doing in the rest of the body, because it is the most electronegatively charged ion element out there. And so it will compete with other things, and the big controversies like iodine, so thyroid health, and if it is making our enamel structure different and wavy and weaker, well, then what is it doing in our bones? And so this is where some of the studies have shown skeletal fluorosis or bone fragility. This is where if we get too much, we have fluorosis, which truly is the enamel is defective and deficient. And then, of course, neurotoxicity too. And so from a functional standpoint, you can say, okay, yeah, fluoride makes teeth quote unquote stronger, more acid resistant. Maybe it helps arrest or reverse cavities. But if you take a step back, at what cost? And we need to be looking systemically beyond the tooth. And this is where I think dentistry has failed, is we're so hyper focused on teeth. We're not looking at the whole big body picture and the whole child. And I've heard you say this before, Mark, and I've borrowed it. I hope you don't mind. But we only have one chance to develop a brain in a child. I can't fix their brain development if something goes awry. Now, we know there's neuroplasticity, thank goodness, and there are ways to maybe course correct to some degree, but, I can fix a cavity in a baby tooth. But I don't need to, because now there's a replacement that's biomimetic hydroxyapatite. And what I mean by that, of course, we're still going to have cavities, but it's not like saying we don't recommend fluoride. Now, there's no alternative. There is an alternative. It's better. It's biomimetic. It's what our bodies already have in it. It's safe to swallow. It works just as well. Studies are showing it's outperforming. Clinicians across the globe are commenting on how incredible, particularly nanohydroxyapatite is in their patients with early and even mid-range decay. So it just seems like a no-brainer. And so just trying to be open-minded to this research and actually sitting down, and I'm obviously speaking to any colleagues listening, just like sit down for an hour or two one Sunday afternoon and read the new studies. These are studies you were not exposed to in dental school. I went to dental school 20 years ago. It's hard to even say that. I mean, time goes so fast. Things have changed, thank goodness. In 2 decades, science has changed. Yes, that's the whole definition.
It doesn't make sense. Just in review, for something to fluoride can outcompete the natural product, which is in saliva, some calcium, and because it's more electronegative. In other words, it has an extra electron on it, and when that demineralized site sees minerals, it's going to grab the one that is more attracted to that site. So you're replacing it with something that the tooth really needs, and that's sad. Not to mention, as you said, the effects to bone density and hip fractures and brain health, and especially in the developing brain. So
we're learning more and more. I mean, there's some studies showing that it affects vitamin D conversion and bioavailability. So, I mean, it's doing a lot of harm. Yeah. So should we talk about percentages, which is so confusing?
We've talked about particle size. We're pretty clear on that. Although I think we've mentioned before, the EU may redefine particle size, but I think everyone knows what nano is. Nano is a manufactured product, not that they're making the calcium from scratch, they're just making it smaller. But yeah, let's talk about
therapeutic dose.
Therapeutic dose, or the efficacy, therapeutic dose. Yeah.
I'm going to be the first to admit that I misinterpreted the data years ago. And you and I have talked about this.
Yeah, I think we both did.
Boy, have we talked about this. I mean, we might be guilty of some of this misinformation.
Right.
So we used to tout, oh, it has to be 10%. No, actually, it needs to be 15%. This is speaking of nano.
Right.
Well, this all goes back really to one study in particular. Now there's a couple that shows it's comparing hydroxyapatite, just hydroxyapatite is what's in the study, to fluoride. And it concludes it needs to be 10% to be as efficacious. Well, you and I dug into this and we said, well, what type of hydroxyapatite? Right. Is it nano? Is it micro? So we reached out to the authors of these studies to say, what the heck's going on? There are brands and providers out there who are stating, and again, I used to do this too, so no judgment, that you have to have 10% nanohydroxyapatite to be efficacious based on this study. And I know that they're citing the same study. We've reached out to the author. They were using micro clustered hydroxyapatite. It's not nano. It's essentially a micro version.
Right.
And the other issue with this study, it was being compared to an extremely low dose of fluoride. It was 500 parts per million.
That was shocking, yeah.
Which actually fluoride in toothpaste is 1,200 parts per million.
Right. So
of course, a 10% micro hydroxyapatite is going to, outperform such a low dose of fluoride. Right. So let's actually look at the nano research. So we have befriended many in this realm, researchers, manufacturers, essentially nano experts. And the studies, there are white papers, and we will link them all. It says you need 1 to 3% nano hydroxyapatite final concentration in your product to be efficacious.
It's all mixed up, right? Final concentration.
This is the other issue is you start, and it's so hard to verbalize this, and we're going to help soon with a visual on this, but because I'm a visual learner, but so many people are claiming these extremely high doses, but are they talking about the initial solution, or you could say powder, that was used to create the final product? So I can take a 15.5% starter solution of nanohydroxyapatite, but by the time I add it to my toothpaste and I add water and I add xylitol and I add this and that other ingredient, well, that's going to get diluted down to, we hope, between 1 and 3% final nano concentration. So a lot of companies are saying we use 15% nanohydroxyapatite, or they're saying that it's confusing. It seems like that's what's in their final product, but that's what they started with. You want to know as a consumer, what is the final concentration of hydroxyapatite in that end product? And I will tell you, quality nanohydroxyapatite, which we'll get more into this next episode, it's very expensive. It's very expensive. And so you and I, Mark, we can tell by looking at the price point of some of these products that we don't think they're expressing their percentages accurately, and or they're using a substandard form of hydroxyapatite.
And it's probably not malicious. I mean,
no,
we're not saying
not.
that.
absolutely
because
not.
we were confused for a long time,
Yes.
or not well informed, and it takes a lot of. Well, when you reached out to the researcher, which I thought was a real baller move, I thought that was great.
He said
What?
no one, by the way, I will say,
Yep, no one. Yep,
no
that's what I
one
wanted you to say.
has ever contacted him about his study before. And I
Right.
was shocked because there are people talking about his
About it.
study and
Yep.
using it as in their branding and marketing. And, you know, the studies are using Carex, which is out of Germany, and that is a microcluster form.
Yep.
And they conveniently claim that their microclusters break into nanoparticles when they want to, and then other times they say no, they don't. They don't. So anyway, it's basically everyone we've spoken to, the research we've done, that's a micro product. So the 10% claim, that study is referencing micro hydroxyapatite, and the white papers are showing 1 to 3%, which those are what the brands you and I have been recommending for years are using.
Right.
So if anyone's bashing a brand because they're only using 2%, you know, that is efficacious, actually, based on the research.
Classic example of quality as opposed to quantity. And the reason we're talking about this, it's important to remember that Nano works better, deeper, penetrates more deeply, does a better job of remineralizing teeth and desensitizing the porous root structures of your teeth.
And whitening.
And whitening. Than does the micro. And so if you're looking at 10% micro, who cares? I would rather have less Nano at the therapeutic dose, or a mixture. Micro has its place, but it's not really in remineralization. It's great at ionic integrity, at providing for ionic integrity.
I think having both is optimal.
Yeah, right.
But as a clinician, having dug into this research now, how long have we been doing this, Mark? Like 2 years?
2 years
at
least.
I mean, at least.
Right,
like when we've been actively talking about it. We've been waiting to do these podcasts for literally over a year because we wanted to make sure we fully understood. We spoke to the right experts. We spoke to the researchers. But we're very pro Nano, and we're going to get more into that in episode 3 because I still know it's a safety concern out there, which I hope we dispute that for you. This is a very United States centric conversation. We speak to colleagues in other parts of the world, and they're just shaking their head saying, "Wait, what? No, nanoparticles." Again, quality are extremely efficacious, much more efficacious than microparticles. There's no room for debate, and they're safe. There's no cytotoxicity. You know, all of these claims that we'll get into.
So I think in summary, just make sure that whatever toothpaste you're using, that the claims that they're making are scientifically grounded, that they understand the data. Again, it's very confusing. But remember, it's not always about the amount in life in general, right?
Yeah.
It's about the quality, how it's delivered. We're going to talk more about that in the next chapter. There is one version of the Nano that isn't just a powder. It is a very specifically formulated globule, fluid-like globule that is great at staying in saliva and then releasing its active ingredient, which is the nano hydroxyapatite, a piece of calcium that is perfect for remineralizing the teeth. So it's really about the delivery mechanism. It's about the reputation. It's also about who considers it to be safe. There are certain types, not only size, I think it's more about particle type. You know, again, needle shape doesn't sound very appealing. It sounds like it can get caught in tissue, but this stuff dissolves. There is a safer size, not size, but particle type.
Shape. We want broad shape, not needle
broad shape. So really don't go based, if you're comparing 2 or 3 different types of toothpaste, and if one has fluoride in it, drop that right away, of course. But if you're comparing between the strength or the claimed strength of a nano, or just even if it just mentions hydroxyapatite, be very, very careful. There's more to it than that.
Yeah, and we sorry to interrupt, but
no problem.
Someone explained this to me, or someone said this and it really stuck. I like the way they described it. So we know with supplements, there's very high quality supplements that are bioavailable and that work.
Right.
And then there are ones that are basically garbage, right? So if you go into your local pharmacy and just pull off some supplements off the shelf, that's probably a waste of money. You really need high quality supplements. This is the same with hydroxyapatite and Nano. They're apples and oranges out there. So just blanketly saying Nano hydroxyapatite is blank is not fully understanding that quality matters.
Right.
And again, we'll get into that more next time. So,
so the pH of the toothpaste, the ionic integrity, how does that Nano live in saliva? How well is it bound up into suspension? How quickly can it precipitate out? And also, it's not about percentage, it's about bioavailability. You could have much less of something, and if the uptake is much greater and more efficient than a toothpaste that has like 4 times as much, what's the better product? And that's what we're going to be fleshing out over the next few weeks, and that's what's important.
Great. Yeah. This was a lot. I hope everyone was able to hang with us, but
we
had to talk about it. We had to talk about it.
Absolutely. We're a little bit beyond the 30-minute mark, but that's fine. Yeah. So next time we're talking about safety.
Safety.
That is a big topic.
Yes.
We are well prepared. Again, 2 years of research. But I think with the ruling of a very, very important body in the EU, a bunch of scientists, we'll talk more about that, that has made it much easier for us. But we already were thinking that that was the one version of Nano that they were going to approve. And we're very happy that they did, because it just really allows all these brands and people that are concerned about anything that's Nano, and we'll flesh that out in the next chapter, why this is different when it comes to talking about Nano than it is hard particles that don't dissolve like metals. It allows the industry now, the toothpaste industry, to really incorporate something that is much safer for our children. It's actually more effective when it comes to whitening, desensitizing, remineralizing teeth. This will allow the floodgates to open, and hopefully people won't be too concerned about it. But Nano hydroxyapatite, amazing stuff. Get rid of fluoride. Amazing that we can do that now. We've been harping on fluoride for a long time, but without a replacement, it's kind of a tougher argument. Now it's simple. So we'll talk more about that next time.
Love it. Thank you, Dr. Burhana.
Thank you, Dr. Staci. This has been fun. And we will definitely be talking more about this as things develop. I mentioned earlier that there may be a redefining of size and all that, but the good news is that these are very, very skilled scientists. We'll talk more about this group in the next chapter. And the good news is that we've got some great alternatives when it comes to toothpaste. Very excited.
Yes.
Yeah, good.
More to come.
More to come.
Thank you.
Chapter 3 coming up in the next few days. Stay tuned for it. Thanks everyone for staying tuned in. Hope that wasn't too complicated and too involved. I think we did a good job of just keeping it. I think we got our points through, the important ones, without losing anyone, including some dentists, right?
Yeah, it gets pretty sciencey pretty quickly.
It does. Great. Thank you.